Welcome to Nourish MD, Dr. Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice Private Physicians Medical Associates, PPMA, with your hosts, Registered Dietitians and Nutritionists, Lauren Papanos and Romana Brennan.
Yeah, I think the most important thing to note with that, though, is that you definitely want to make sure you don't take vitamin D before bed, because vitamin D is something that's naturally made by the sun, right? And so it goes with our circadian rhythm, which is our body's own kind of sleep-wake cycle. And there is evidence to show that if you take vitamin D before bed, it can actually impair your circadian rhythm and it can actually impact your sleep quality. So just make sure that if you are, I always like taking to recommend vitamin D at lunchtime, because that's generally when it's going to be the highest in the, outside in the sun as well. So I definitely recommend that you are taking it at lunch, if not taking it at breakfast time. That way it's not impacting that circadian rhythm. And with that too, it's really important to understand just how melatonin is naturally made by the body, because it is a process. And if you look at that process of how it is made, your body needs particular amino acids, and it needs something that's called 5-HTP. 5-HTP and tryptophan are two really important pieces of our body's ability to be able to make melatonin. And that process really requires having some complex carbohydrates. And a lot of times people, they think that if they eat complex carbohydrates at dinner time, it's actually going to cause them to gain weight. I know I hear that a lot from people, but actually in the evening time, what the research shows is that it's actually your fat metabolism that drops off. It's not necessarily your carbohydrate metabolism that drops off as much. So your ability to burn lipids from what you've consumed that meal is what's more impaired. And we know that we need those carbohydrates to be able to, one, help lower cortisol levels. We know that complex carbohydrates help lower cortisol, which is important for, making melatonin and helping calm the body to get into that relaxed state. But those carbohydrates also are what help to be able to push that process so that our body can make natural melatonin. So if that's something that you're doing where you're like avoiding carbs at all costs at dinner, you might want to reevaluate that. We definitely want to make sure that they're in alignment. You're not overdoing it on the amount, and that you have the right foods paired with those carbohydrates, and that they're the right source of carbohydrates. So there are some nuances to that conversation. But it actually is really important that you do have some there, because they're actually going to help your sleep. And if, like Romana said, if you have better sleep, not only do you feel more energized the next day, but we also know that sleep is tied to greater weight loss ability, better blood sugar improvements, less chronic disease risk, right? So better sleep is going to mean better ability to manage your weight and improve disease risk and things. So that's a really important piece. Some others that I really love, myo-inositol is a particular type of sugar that has been shown to really help with sleep. And especially if you pair it with magnesium glycinate, when magnesium is bound to glycine is a type of amino acid that's very calming to the body. You get an additional calming effect of the magnesium, and that glycine really helps to be able to support that process. There's also an amino acid that's called L-theanine, and this is commonly naturally found in tea. And it's one of the reasons why when you drink like green tea, for example, you don't get as much of that crash afterwards as if you drink a cup of coffee. And that's because the green tea has natural L-theanine in there that actually helps to be able to kind of stabilize how your body metabolizes the caffeine so that you don't hit that crash, versus coffee doesn't have natural L-theanine in it. But L-theanine has been shown to be able to help to support calming the body and help with sleep quality as well. So I really like to pair all three of those together. And that could be a really great way to be able to support sleep. And again, in people, like you said, who maybe melatonin, calming herbs don't work well for them, they don't want to go that route for whatever reason, it could be another strategy that's a little bit more like vitamin and mineral based outside of just the melatonin and herbs.
Absolutely. Do you recommend people take that trio before bed? How soon?
Yeah.
How soon before they're sleeping?
I always like an hour time frame for any of these things, because it's going to take some time to get through your stomach, absorb, get into circulation, those levels to build up. So yeah, kind of like as you're cleaning up for dinner is probably a good time to initiate that.
Awesome. Yeah, all great recommendations.
Yeah, let's get into some just like lifestyle things that could complement some of these supplemental strategies. We talked a little bit earlier about just some of the things, we want to prevent, like being in a stress state and drinking alcohol and such before bed. But why don't we talk about some of the things that someone can actually add in that could help support sleep quality?
Yeah, absolutely. First and foremost, if you're not already maintaining somewhat of a regular sleep schedule, that's going to be so important to ensure that your circadian rhythms stay as regulated as possible. Of course, this is going to look a little bit different if you're traveling or switching time zones. But when we say regular sleep schedule, what the research has shown is anywhere within 1 hour. So let's say you're normally waking up at 7, if there are some days, even on the weekends included, if we can extend your wake time an hour in either direction, that's going to be kind of that comfortable range. So if your normal wake time during the week is 7 a.m. on the weekends, can we ensure that you're up by 8 latest? Or if you need to wake up a little earlier, as early as 6. So kind of maintaining within a 1 hour range of when you're normally there. Otherwise, if you can limit it even further, so between 6:30 and 7:30, for example, having that optimum 1 hour window is going to be ideal. And the same goes for when you're going to sleep, right? Because just as important as it is to have a wake up time, having a sleep time is also important to get your circadian rhythm regulated. How you were mentioning the timing of the melatonin, for example, our body doesn't just start making melatonin the second our head hits the pillow, right? Like there's a buildup process with the hormones in our body. And so it's really important to maintain that schedule. Even I know the holidays, holidays are a difficult time, as well as maybe some other, whether it's a birthday or whatever. But we can really support our sleep schedule by trying to maintain within that 1 hour waking as well as going to sleep, period. So maintaining a regular sleep schedule, I would say, is one of the most impactful things that you can start to implement.
Yeah, definitely. And that, if you've ever had a baby, then you probably know that that works for babies. It also works for animals, right? We're just creatures of habit. And so as humans, we're no different as grown adults, right? So we have to make sure that we're still honoring that for ourselves. In addition to that, some of the research that I really love on the role of heat exposure and sleep is really awesome. And this is something that I practice nightly that I really enjoy and really do feel like makes a difference for me personally, and that I've seen with a lot of clients. But what we've seen in the research is that heat exposure and the heat shock proteins that are created whenever you're exposed to hot temperatures, when that happens, your body is forced to make something called adenosine triphosphate, which is essentially our body's source of energy to be able to combat those heat shock proteins. And that adenosine piece of that adenosine triphosphate is really great for the brain and helping with sleep quality. And we know that the sweet spot for this is somewhere around 1 to 2 hours before bed, getting exposed to these hot temperatures, because we want to make sure that we still have enough time for the body to cool itself down. You've probably seen before that sleep hygiene is really important. And if you are going to sleep in a hot room, then that definitely is going to impact your sleep quality. And the same goes if you've been exposed to really hot temperatures. It's going to impact your ability to get deep quality sleep if you are still trying to cool yourself down when you're falling asleep. So somewhere around 1 to 2 hours, I would say closer to 2 hours if possible, is ideal there. Otherwise, you could take like a very quick, cooler shower to be able to help facilitate that process. Just be mindful that if it's too cold, it can obviously wake you up more than it can relax you. So that's why if you can, just having that time frame is really helpful. And this could be either a sauna or a hot bath. So the research has been done here with either dry saunas, which were around 160, 170 degrees Fahrenheit for about 20 to 30 minutes. I personally use a sauna. It does not get that hot. It's very challenging to get ones that do get that hot. I believe ours only goes up to like 155 or 160. So I go in for a little bit longer, closer to 30 to 45 minutes, depending on the time that I have. But that's an option. If you do need to go in at a lower temperature, then you just need to go for a more extended period of time and make sure that you work yourself very slowly up to that temperature. Don't start off at 45 minutes. You really want to listen to your body and slowly build that capacity. But there's also been research done in China where they've looked at just hot baths. and the hot baths were around 105 degrees Fahrenheit. You can get a thermometer if you want to check. Because once you get the liquid filled up, you might need to add more hot liquid to be able to keep it that temperature. But you're looking for an average about 105 degrees. You want to make sure that your shoulders are immersed, not your head, but at least your shoulders, because that's going to help heat up the whole body, and that you're in there for about 20 minutes. And either of those are great ways to be able to get some of the benefits of that heat exposure to be able to support that deep quality sleep. So give it a try. I would say the research is kind of shows aiming for as often as possible. But I would definitely see if you could try to get to 4 days per week at minimum. But if you can do it 7 days per week, even better. And you can always, of course, alternate between these two practices as well, between hot bath and sauna, depending on what you have access to. Outside of heat exposure, there's a lot of other really great things. We talked about like movement throughout the day and how that's really important for deep sleep. But maybe Romana, you could touch on a little bit more as it relates to just circadian rhythms. I know that we've kind of thrown that word around. We haven't talked too much about what that means and what influences it, but maybe you can just talk a little bit more about the totality of the day and how we can support our circadian rhythms and how that goes into our sleep.
100%. So our circadian rhythm essentially is this 24-hour clock in our body. And we know that one thing that helps set it in the morning is light exposure. So we don't just want to think about what we're doing in the evening time. Of course, creating an evening routine is super important. And you had mentioned a bit about blue light exposure, screen time leading up to bed, these things that can suppress melatonin production. So certainly creating an evening routine, ensuring that you're implementing relaxation strategies to put you in that parasympathetic rest and digest state before you go to bed. Screen time, blue light exposure are two very impactful aspects that we can really ensure that we're minimizing. That's one. It can be harder than a lot of people think to address and to change those habits before bed. I know, myself included. But maybe it's implementing blue light glasses once the sun goes down to ensure that from the time that the sun is setting, which is, within our evolutionary biology, the time that we would naturally want to start winding down and going to bed. But if we can minimize our blue light exposure, that's going to help with our natural melatonin production, which helps set our circadian rhythm, helps keep that regulated. But then going back to the morning time, we want to ensure that we can have some type of light exposure, ideally from the sun. I know some of us are maybe waking up before the sun. We can talk about a strategy to still get that light exposure, to get the appropriate brilliance of the light in our eyes. But if we can get morning light exposure within the first 30 minutes of waking for about 15 minutes, that helps signals to the brain that it's time to wake up, that it's time to, it kind of like starts a 12-hour clock, so that once 12 hours after that light exposure, our body knows, oh, it's probably time to be winding down. Maybe we start producing more of that melatonin. So it's all really important part of the process, like these little checkpoints. So we have our checkpoint in the morning, our checkpoints in the evening, all contributing to our sleep quality and quantity, of course. So if we are someone who might be waking up early, I know it can be super helpful for individuals who maybe have kind of a funky work schedule where they're not waking up in the morning and going to bed in the evening, maybe like a shift worker. Utilizing a light box can be very helpful. I know some people say just turn on all of the lights in your home, but unfortunately we don't get quite the same brilliance from the sun, so it doesn't get the same effect. But utilizing a light box as the main source can help mimic that if you are someone who in the morning time, those first 30 minutes when you're waking up, either you're not able to get outside or sunshine just isn't out. The sun isn't out. So that's something. Are there any other tips and tricks, Lauren, that you like to utilize yourself or recommend to individuals that you work with?
Well, yeah, like you said, we know that the two things that really help support that initial cortisol response in the morning is light and food. So if you're not doing either of those, if you're fasting in the morning, you're not eating, and you are not getting light exposure, then of course you're going to have issues with sleeping at night. So we want to make sure that if we're able to, that we can get both in, that we can eat and that we can get light exposure pretty soon after waking, like you mentioned. And then really thinking about the flip side of the day is that in that 12-hour time period after we wake up, we want to start being mindful of how much light exposure we're getting. And, really those blue lights, like you said, are the biggest culprit because they block our body's ability to make that adequate melatonin. But, even just like bright lights in the house too. And so it might even be just dimming the lights and kind of making a little bit of a darker environment. Think of like if you were a caveman, right? You wouldn't have the ability to have fake lights, and those artificial lights really impact this whole natural response so much. And then same thing with sleep quality. I mentioned a little bit about like sleep hygiene, but we want to make sure that the room we're sleeping in is pitch black, that there is no LED lights, that there's no little glimmers of light coming from the outside, that it really is as dark as possible, and that it's as cool as possible. We know from the research that I believe it's like 67 degrees is the optimal temperature for sleep, right? So it is a little bit cold. I usually set it at closer to 68, 69 myself, but we definitely want it to be really cool. And then the warmth should be coming from your body, being able to keep you warm, and then covers, of course, too, for whatever you might need. And if you, have troubles with that, there are even mattress pads. Like we have one that I really love. It's called Sleep 8. And it is something that there's like water that's connected to it. And you can set the temperature to keep the mattress cool. And so if that is something that you struggle with, or you don't want to have the air conditioning on, you don't have air conditioning, then a sleep mattress pad that does provide that cool temperature could be a really good option to help with that sleep quality.
Yeah, I love it. Those are all great strategies.
Awesome. Well, as we mentioned, throughout the episode too, sometimes these things require a little bit of personalization. So if you're listening to some of the things we're talking about today and you're like, wow, that's a lot of information. I don't know if I could do all of those things. And what are the things I should really prioritize for myself the most? Then definitely give the office a call to set up a nutrition appointment to be able to really get that individualization, taking a look at your labs, understanding your lifestyle and your goals and just what your needs are better, so that you can get the most personalized recommendations for your own sleep needs. But we will be back in 2 weeks with a new topic and a new episode. If you haven't already signed up for the group session this month, be sure to do that. We'll be going into even more strategies around sleep, and that'll kind of round out the sleep discussion. And then we'll be back next month with a completely new topic. But thanks so much, Romana, for joining me. Such a great discussion, and looking forward to our next episode together.
Thanks, everyone, for tuning in.
Thank you for joining us for today's episode of Nourish MD, Dr. Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.